I had a patient who came in with severe plantar fasciitis that was bothering him for months. We're probably talking 6 to 9 months. He'd stopped running. It was becoming painful to walk. We went through treatment for 3 to 4 weeks. His pain dropped significantly. He was having mild stiffness and soreness first thing in the morning. Work was starting to get a little busy, and he just stopped coming in. Well, next thing we know, I see him 6 months again, and his foot has flared up. It's back to that sharp 7 out of 10 pain, pretty severe during the morning and also during the day whenever he'd stand up. So we go through the treatment process again. We work his foot with the heat, ice, electric, stretching, exercise, Graston Technique, and it would get better. Sure enough, he stopped again. It flared back up 6-7 months ago. And it really comes down to certain conditions, you have to get them all the way better. If you stop too early, it's probably going to flare up again. So here we are again, working the heat, ice, electric, stretching, exercise, Graston Technique. Now we're doing shockwave therapy on his foot. He's getting better, but he needs to not stop too soon. He needs to make sure he gets all the way better so this condition doesn't come back again.